Hi, I'm Dr. Swati Kumari. I'm a gynecologist, obstetrician, and fertility specialist, and I'm making this video today to increase fertility awareness. I think this is very necessary, something that people should know about and they don't know about it. Okay, so it's very difficult to be a woman, and I understand that. How many of you have heard, this is the age to get married, you should get married soon. Oh, you should be planning a baby soon. If you don't plan soon, you may never be able to get pregnant. And this puts a lot of pressure on a woman. The pressure to get an education, find a job, settle your career, find a partner, and have a baby, all within a certain time frame. And this can be very, very exhausting. Okay, women actually undergo a lot of depression and anxiety because of all the pressure that's put upon them. And this is not a good thing. Yes, there is a biological clock, there is. And the ovarian reserve of a woman does decrease with age, but there's also something called fertility preservation, something you can do about it. There's a way out, there's a solution as well. When a girl starts menstruating at around the age of 12 or 13 years, she has around 500,000 eggs in her ovaries. And these eggs gradually start decreasing with each cycle. When she reaches around 30 years of age, there's only about 10% of that amount left. And when she reaches 40 years of age, only 3% of that is left. So yes, this can sound very alarming, but if you reach an age of 30 years, let's say, and you're not ready in life, you're not emotionally ready, you're not ready socially, you're not financially ready to bear a family, have a child. So at this time, you can actually think about oocyte preservation or preserving your fertility. This is done by a simple ovum pickup procedure. This procedure is almost half of an IVF cycle. I guess you can understand it like that. From the day 2 of your menstruation, around hormonal injections are started. They're given for around 12 to 15 days, usually, sometimes more. And all the follicles that we see in the ultrasound, they're forced into maturity. Then inside the operating theater, under anesthesia, these oocytes are collected, okay, on the transvaginal probe. There's a needle guide, and we pick up using a needle through the needle guide, we pick up these oocytes, we take it in the lab, we cryopreserve it in liquid nitrogen for many years. Some countries allow cryopreservation for around 10 years, some for even more than that, and they can be cryopreserved. When you're ready to start a family, they can be thawed, fertilized, a baby can be formed and implanted back into your uterus. You can relax that your uterus is able to bear a child even after you've crossed menopause. The capacity of the uterus to bear a child does not decrease. Yes, as your age increases and you become pregnant, the pregnancy becomes more risky. You're more susceptible to problems like hypertension and diabetes. Those problems are there, and those risks you need to understand. So I hope this video shed some light on fertility preservation. And if you like this video, please subscribe to my channel. Follow me on Instagram and Facebook. Thank you.